saying, you know what, I can't do this anymore, so I'm going to kind of really, stop or try to change the way that I'm approaching this. And then the actual way the voice is being produced, which is the performance. And then, so we're looking at that broad picture. I hope that answered the question.
So many things in there can answer the question. It's wonderful. So it sounds like maybe I am okay with the old definition that just that report of feeling whatever that feeling is, that is fatigue to me as the talker, is enough to say there's a performance degradation, so that it would still fit the definition of vocal fatigue and not just vocal effort. Okay, that helps. So I feel I didn't mess up by giving a very old definition. And we are still trying to figure out what to measure. I want to throw one more term in there, and that is the term of vocal hyperfunction. Where does vocal fatigue stop? Vocal hyperfunction start? Is it the same thing? And maybe Marco would like to address this, because he talked a lot about that feedback system of talking and then what we do in reaction to it. Marco, are you there?
Yeah, it is activated. Yeah, I'm sorry. Yeah,
You're
it was
good.
muted.
You're good.
Sorry.
No worries.
Yeah, I had some background noise, so I muted my microphone. Yeah, I think hyperfunction is a very tricky concept. I don't think it is still quite understood, because what is hyperfunction? It's an auditory perception term. It's an laryngoscopic feature. So what is real hyperfunction? Because there is enough evidence demonstrating that when we see some laryngeal hyperfunction, you can observe that in people with voice disorders, and also you can observe that in people who are very vocally trained people, such as professional singers or actors. So what is real hyperfunction? So that is the question that we need to ask ourselves before to define what is hyperfunction. But of course, I agree with you and with your paper published in the International Journal of Speech, Language, and Pathology, and that you make a relationship between vocal fatigue, vocal effort, and vocal hyperfunction. I think that in people who feel vocal effort and who feel sensation of vocal fatigue, and people that demonstrate objective variable related to vocal fatigue, we can say that those aspects are associated with at least with an auditory perception of vocal hyperfunction and a self-perceived sensation of vocal hyperfunction, which could say that is vocal effort. So this is a very important aspect, because I don't really know if we really understand what is really hyperfunction. You know what? You see my point?
Yeah, the way I look at it is when the muscles are overactive, more active than they need to be for an efficient and economical voice, as you point out, they should be hyperfunctional, but that's like a muscle measure.
Yeah, and unfortunately, so we are now performing a very nice study using Myotone Pro. I don't know, guys, if you know Myotone Pro.
Yeah.
This is a very nice device to objectively measure muscle tension, muscle stiffness, and muscle flexibility. So this is an objective measure. So we check the literature before starting our research. We found that all published papers related to muscle hyperfunction and voice disorder, are using subjective measurements of voice, of muscle tension. So can we really measure muscle tension by touching, by palpation? Is that reliable? So there is not any publication using objective measurement of muscle tension and the possible association to voice disorders. So we are now performing the study. We hopefully we are going to get about 90 subjects in total. We are now stopped because of the pandemic, of course. And so I think it's a very, very difficult question to answer, because what is hyperfunction?
That's very interesting. I don't know if you know, I use the myotone. I've done it on the tongue and the face. and I tried it on the neck. So good luck. I hope you can make it work.
Yeah. Hopefully we will have the result in 1 more year.
Awesome. That's great.
Yeah.
I know for sure. I know from many years of conversation with my auditory science friends that they struggle with this, and I think this is the bane of Stefanie's existence. Stefanie, would you like to comment at all on how the field of auditory science has been dealing with effort?
Yeah, thank you, Nancy, and thanks for inviting me. For those of you who don't know, I am the outsider to this group. My training is psychology, psycholinguistics, hearing sciences, but when I sitting next door to Nancy and talking to her, I realized we're tackling very similar problems from very different perspectives. And so this was just a phenomenal opportunity for me to get some insight into how you all have been tackling it, the frameworks and models you've all developed, and the parallels are striking, but so are the divergences. And one of the things that struck me the most is the importance that is placed on subjective feelings of fatigue. And in our fields, of course, the subjective feelings of listening effort matter quite a bit. You have a patient come in, that's what they're reporting to you. That's the thing that you want to try to diagnose. What's the source of that, and what's the right remediation for that. But in addition, in the research domain, we've found this real big disconnect between subjective report and what we call objective measures of effort. And in particular, we're focused a lot more on the mental side of the cognitive load that listening to a degraded acoustic signal requires, that you bring online all of these top-down cognitive mechanisms to help you fill in the gaps. And so I just wonder if that's sort of the reason that we have sort of unreliable insights into that sort of mental fatigue that people experience. Older adults in particular are underreporters of effort and fatigue, at least anecdotally, and some indication that might be true. And so, is it because it's that mental source that's hard for people to introspect on, whereas the other more physiological or physical sources maybe people have better awareness of?
So the subjective measures, you also use subjective measures, right, in your work with pupillometry, and how well do they correlate?
Yeah, so it varies a lot from study to study. In my own work, I've found a correlation between some of the subjective, how much effort did you have to exert to accomplish the task? I've found some correlations, but many other times in some of my other studies I haven't, particularly with older adults. And many other studies have also not found correlations. And I think part of it comes down to definitions and, are we talking mental effort? Are we talking something else? What's the time course we're referring to? And then the other half is these biases that people have about being really bad at reflecting on their own abilities. We wait to the end of some very long task and we're like, how hard was that? And you're like, well, it's over and I survived, so it must not have been that bad, right? So there are just some of these cognitive biases that can come into play that can make this disconnect larger. But at the end of the day, subjective, like I said, that's the thing that we want to make people feel better about their,
There's so many studies where I'm happy I've included a subjective measure because it saves me when the objective measure doesn't work. In fact, Marco mentioned in his presentation a study where only the subjective measures told the difference and the objective measures did not. So we're still trying to come to terms with how to measure. And as scientists, I think that's where we tend to go, which is great in clinic. In the roundtable discussion the other day, Edie Hepner had talked about how measuring effort was her go-to now, and that she's using this Omni Borg type scale. Chaya, is that the same scale that you talked about and called, what did you call it? Something other than
the rating of fatigue scale? No. So the Omni scale is also a scale of perceived exertion. Okay. So in the field of exercise physiology, there are 3 different perspectives to exertion. One is the Borg perceived exertion, and there are like 3 or 4 versions of the Borg. And then there is an omni-perceived exertion, which is specific. Again, I think there are like 10 or 12 for specific exercise-related activities and the drawings for those. And then there is a newer approach that takes away top expressions like discomfort and fatigue that goes with the perceived exertion. So we're thinking about, like, if we go into the rating of fatigue scale that I mentioned is only purely right now in the exercise physiology literature, where they have taken this scale to differentiate between state fatigue and perceived exertion.
Thank you. Great clarification. So I'm going to invite the panelists to ask each other maybe a question or two, also to get us talking about some of the key issues. Are there particular questions that you'd like to ask each other? And just go ahead when you're ready.
Hey, Nancy, I just want to kind of follow up on a little bit of what happened with Stefanie and what Chaya said, and the objective measures. I know I've been totally frustrated by the idea of how do we measure fatigue objectively, and it hasn't been until recently, and we've kind of come to some potentially new ways to do it that we can, and I kind of highlighted very, very briefly in my talk that it's like what Marco said, he could measure it with ratings or some kind of subjective thing. When we balanced on our last set of studies, the objective with the acoustics, they couldn't be separated. But once we used both, then the objective data made all the sense. And the variability wasn't the same way we had it before. And I was actually quite astounded at the clarity of the objective ratings if we subdivided using the objective and the subjective, and that is the only way we could do it. And I'm still kind of a little bit floored by it, but it was just some of the most beautiful data I've seen in a long time.
But looking at the data that your doctoral student Mark Berardi had published, that you flashed up for a bit, it looked like the people that had, if I got this right, of course I wrote notes but I can't find them, the people that had had a low response didn't differ in their objective measure, but the people who had a high response did. So it looked like there was just split 50-50. So I was a little surprised you got a strong response.
It wasn't, that was one part of it. If you think of a quadrant, if we divided by those that had low subjective response and or high subjective response, or we had on the other axis low and high objective like performance. So this is like vocal stuff. If we divided like that, then within each of the bins, if we then looked at their acoustics, their acoustics told us something, like they were either very stable or there was great change. And what was most interesting is when Mark and I were looking at this, is while we were doing a very heavy demand in a noise environment with some cognitive load of describing these maps, most of these clarifications happened within like the first 8 or 9 minutes because we were measuring through, and so we didn't need the entire time, and which I was surprised. So I mean, while that helped to show further fatigue, the differentiation in the groups, and so what I like about the groups is once we can subdivide into groups, then and we can then say, all right, who has capacity, who needs the efficient training, who has, and Susan Windling from Finland or Sweden talks about it, who has grit, and who was that, when does that grit work against you, you know? So and that's what's so neat, is it broke down all the right pieces, but it was that dividing who's responding in each category, and then each one of them shows a different risk, which was fascinating.
Well, we certainly know that some people seem to be very endurant, that they can just talk and talk and talk and perform and never give out. I assume that's fatigue, also performance reduction, and some people fatigue easily. So as Dan Boone used to call them, the China larynxes and the iron larynxes, or, you know, something like that. So yeah, individual differences, I think, has got lots of answers in it. Others?
Nancy?
Please.
Yeah, I would like to highlight that I think is a very important point. That we have some people with vocal fatigue which compensate using a compensatory behavior, and other people do not compensate too much. So for that reason, it's very difficult to find a very specific marker to detect objectively vocal fatigue. For example, in my research, I have observed that sometimes an increase in the airflow rate could be a sign of vocal fatigue because of the decreased vocal fold adduction. But sometimes the increased airflow rate is not caused because of the decreased vocal fold adduction, but of the increased subglottic pressure, or maybe a combination of both. So it is really, this is a really complex system, and that could be one of the reasons why it is so difficult to detect a specific objective marker of vocal fatigue. So the same happens with the spectral tilt. So you can have, for example, a very steep spectral tilt in people with vocal fatigue, but in other you can find a less steep spectral tilt because of the compensatory behavior. So I wanted to highlight this point.
It's an excellent point, and I have to say that after watching your talk, if I ever have a student again ask me why we need speech science to study voice, I'm going to refer them to your talk. It includes so much beautiful science to explain what we're doing clinically and what we need to do clinically. Actually, I have a question for you, Marco, about your the different approaches of SOVT. So if I understand correctly, you suggest that the narrow tube, like the stirrer, and phonating in water that creates a high resistance is best for lowering the vertical position of the larynx, for making things easier, for just better for overall phonation. There were many, many variables. But blowing into a large tube in water is the one that has the massage effect. So if I understood correctly, and if I'm interpreting this clinically, I should probably start patients with a large tube in water to get a massage and then maybe move to the narrow tube? What do you suggest?
Yeah, what I do in clinic is to ask the patient sensations. So to me, sensation is a huge issue in voice therapy. So this is not only about physics. So semi-occlusions of the vocal tract, we know that there is a very nice background, very nice science supporting the use and the physics of SOVT. But sensation could be even more important than the physics. I think the combination of both are very important. So in order to answer your question, yes, what I try to use to promote first during the first session of voice therapy is to feel the patient a really sensation, a very evident sensation of vibration, not only the one type of vibration, but also different types of vibrations. So I invited to them to explore different sensations. And in order to explore different sensation or magnitudes of sensation, you can use different the diameters tubes. And we know from our results that the sensation of bubbling in your throat is dependent at least of 3 variables. The first one is the diameter of the tube. So the wider the tube, the more sensation of muscle relaxation you feel, and also the vocal tract volume. So when you are performing tube phonation like this, the vocal tract volume increases, and that creates an increased sensation of muscle relaxation while doing WRT. The other variable that I usually control is the airflow rate, which is dependent on the subglottic pressure. So when the airflow rate increases, the sensation goes down because of the bubble the frequency bubble is higher. So, and when the frequency bubble is higher, the body feels less sensation. So, and the other variable that I usually control during voice therapy is the degree of submersion. So there is some evidence showing that between 1 and 3 centimeters of water, people feel more sensation of muscle relaxation while doing WRT compared to a deeper a degree of submersion. So I don't know if I responded to your question, Nancy.
No, it's fascinating to think about the massage effect.
Yeah.
There are lots of questions. I'm kind of scanning the chat. I know there's a lot of discussion going on. One came about more about the vertical position of the larynx that maybe you can quickly address.
Oh, yeah, I'm sorry, yeah. In general, the higher the degree of airflow resistance, the lower is the larynx and the wider is the pharynx while doing tube exercises. So we have found that, for example, when comparing drinking straw and stirring straw, the vocal tract volume increases more with stirring straw, I mean the narrow straw, compared to the drinking straw. And that's because of the higher airflow resistance. And the higher airflow resistance creates a higher oral pressure, and for that reason, the larynx goes down and the pharynx gets wider.
Yes, perfect, thank you. Okay, I keep dominating. Chaya, did you have any questions for anybody else?
I wanted to kind of go back to the comment about Dr. Guzmán's talking about the single outcome measure. I think it's very important, and a lot of people have been kind of commenting on the side in terms of hydration. So again, it goes back to those modulating factors. There are so many things that we consider about fatigue, and we can't really say it's because of this compensating, there are so many underlying things. We talk about central, where we're talking about what is the homeostasis and what are things that go under homeostasis. What is a person's level to tolerate pain? One of Dr. Hunter's paper and Russell Banks' paper on gender effects said that women tend to have more pain than or perceive more pain than men, and their factor 2 scores on the VFI were higher. So I think when we talk about fatigue, it is going to be hard to find that one single outcome measure because there are so many interrelated factors between perception and performance. And within performance, is it neuromuscular inefficiency? Is it the tissue? Like Nancy, you brought those, the three: mental, muscular, and non-muscular. It's important to know, are we targeting tissue? Are we targeting, and then capturing that outcome measure that is actually going to target that modulating factor is something we really need to start thinking about instead of just throwing this one big umbrella saying this is fatigue and we're trying to measure fatigue. I had some questions, but I think if every question that I had kind of came through across in all of those discussions that we had. So
half an hour left, so we're good to hit them.
Yes.
Well, let me pick up on one point you made, and that is about the psychological stress, and that we did have questions, and I'm going to lose who the questions are from that I received in advance, but we've had questions about psychological stress and its impact on fatigue, and I don't know if Stefanie wants to handle that, or if one of the speech people do.
I can start, and then you all can fill in the gaps. But yeah, this balance between your baseline levels of what I sort of talked about in my talk of arousal or ability to engage, and coupled with this, you have to be in the right zone in order to be able to exert effort when you need it. And so this comes from the a lot of the work on the locus coeruleus norepinephrine system that modulates these two states of attention: arousal, am I sleeping, or am I over engaged? Or if I'm in that sort of medium range, if I'm ready to work, that's where you see actually the largest exertion of effort, and then ultimately the best outcome performance. So there's sort of this, we're thinking in terms of treatment. Is it enough to train people to reduce effort, or do we first have to get them in the right mind state to even be able to benefit from that sort of intervention? And so, I think this was brought up in the talks, and Chaya, I think you talked about these individual factors. But yeah, I mean, if you're in an arousal state, hypervigilant all the time due to post-traumatic stress or other factors, you may not benefit from interventions that are aiming to target these mental sources of effort and fatigue.
And a topic that comes up often in our little corner of the world is performance. And when people have a little bit of performance anxiety or excitement, it improves their performance. But if they have extreme performance anxiety, they can fall apart. So arousal is a huge topic for us in performance.
Great, yeah.
Other responses? So I will circle back to something else Chaya had mentioned, which is the 3 components, and bring up a question that I received from Inga Brinkansen from Denmark. Thank you for your question. Humbly asking me, I think afraid to challenge me, but I welcome it, that my conclusion that the intrinsic laryngeal muscles and respiratory muscles are fatigue resistant and therefore are unlikely to be contributing to vocal fatigue. And I admit that that's an admittedly superficial and simple explanation. Clearly, those studies are looking at healthy individuals that don't have neuromuscular disorders. And her question comes from her clinical experience that that patients often have a little bit of weakness, and that maybe so little it's not detected on a laryngoscopy, but that it's that little bit of weakness that may be contributing to the vocal fatigue. I agree that that can certainly happen. I think that it's an interesting dilemma then. Is that what I'm calling pure vocal fatigue, or is that sort of verging on a disorder now? A disorder in the sense of an organic disorder. And I think your point then, Inga, is that vocal fatigue may be an organic disorder, not just a functional disorder. I think I would still contend that some people have it as a pure functional disorder and not as a neuromuscular disorder. But I think that the people that have it as a functional disorder are probably doing the compensation type of activity that Marco talked about with that perhaps muscle hyperfunction, whatever that is. So it's an excellent question. There probably are a lot of people out there complaining of vocal fatigue who have an organic disorder. And sometimes that organic disorder is so subtle that we probably don't detect it, and we just conclude that therefore it's functional. So a really interesting question, and it plays with those lines between terms.
Nancy, just kind of a follow-up on that as kind of build is that's why it makes this whole topic so difficult. Is you can have people that seem to be experiencing a fatigue, and we say this is a thing going on, it's hard to, so we try to define it, yet someone else with a diagnosable disorder experiences fatigue, and they're fatigued because of this disorder. And then you go, well, then are they somewhat related in that is there a capacity issue that the disorder is just bringing out, that then they just experience it more quickly, or is it the experience for some other elevated exertion and effort? Because in a way, then is the disorder a specific obstacle? Using the fuel example that Stefanie kind of brought up there, is that an obstacle that just brings them up to a higher trait and they experience it very quickly, and it's almost a constant a symptom then that they're, so that's what makes it, but then you can elicit the fatigue, because of different obstacles and demands. And so anyway, it just makes it very complex, and which is why I liked what Chaya was doing and trying to specify, is this even a response? And I like the way he did it. Is this even a response to the task? Not necessarily a fatigue, but an accommodation that you have to separate. Anyway, I just liked how you said that with that question. It highlights many of our problems.
Can I add to the complexity of vocal fatigue that so we did, the VFI was established, the vocal fatigue index was established on voice disorder population. Since then, I've done some work on the VFI. Eric is part of the second part of the paper, the Moken analysis. This is an analysis that kind of looks at how within the latent trait of a particular trait, and in this condition, it's the vocal fatigue, within that, are there certain items of the index that are rated differently than other items in the index? And it was beautiful to see. We have 2 sets of data right now. The first is the voice disorder population that we have. And the hierarchy was patients will rate avoidance and tiredness, that is, individuals who are experiencing voice disorders rank easily the symptoms that they experience first, which is avoidance, tiredness, I can't talk, and I want to avoid my voice use. Then comes physical discomfort, meaning everything aches and it's sore here. But our teachers who are with or without vocal fatigue, and we categorize them based on the factor 1, and we notice whether they had fatigue or not, their first symptoms that they rated higher or that they experienced were physical discomfort. And then came rest, meaning I have physical discomfort, I'm going to rest my voice. Avoidance was not even part of it. So this even kind of gives you a little bit idea, as Eric said, the complexity of vocal fatigue. You know, is it our voice disorder? Maybe we have secondary, the consequence of an underlying pathology that is experiencing, that they're experiencing fatigue as a consequence of something obstacle right here. And so they're saying, okay, this is work to talk. So I'm experiencing tiredness, so I'm going to avoid my voice use. On the other hand, our professional voice users, where they have increased vocal demands, and then their demand response says, am I using neuromuscular inefficiency to meet the demand response? So I have physical discomfort. And then my immediate step is, I need to rest my voice because I've talked so much, but I really can't avoid my voice use because I'm a teacher, or so this kind of really talks about how it's we can simply throw the term vocal fatigue, but it's not as simple as, yeah, I'm experiencing vocal fatigue.
And there are definitely questions about, this whole sense of effort and how it's affecting the brain, and I brought it up in my talk about how some of our therapies actually capitalize on increasing effort on purpose and then recalibrating it. And I think that this is really relevant to this discussion. Stefanie, do you have any knowledge of the literature at all on how the brain reacts to training so that effort changes?
Yeah, so it's really important that the point you just made of thinking about this kind of non-linearity in effort and performance, that sometimes we need to train to exert more effort or effort in the right way at the right time. And sometimes we want to minimize effort. And that makes for really complicated a priori hypotheses. What do I expect my training is going to do? And that's why I think it helps to understand, if possible, what are the mechanisms underlying so that we can know, are they being used efficiently? What do they look like compared to somebody that's having no problems at all? And so we've seen actually with speech perception training, a potential increase in effort, at least initially, leading to better performance because, people were giving up. It was so hard. And so a lot of work by Barbara Ohlenforst has looked at a lot of these nonlinearities and seen what hearing aids, have on that kind of function that relates task demand, what we call task demands and effort and performance. And really what the hearing aids seem to do is just shift that function over. So you're still exerting effort, you're just doing so in more challenging conditions, right? So you're giving up in harder conditions than you were before, and you're able to engage where you weren't before. So really considering the range of contexts, I think is really critical to being able to make these predictions about what the benefits of rehabilitation are going to be.
Excellent, thank you. Okay, we're going to the microphones. I believe we have a hand raised from Aaron Johnson. Dr. Johnson.
Hey, good morning, everybody. Great to see you all. Thank you for this great panel. Really terrific topic, terrific folks that are giving some great presentations and good discussion. So thank you. I just wanted to make a plea to not throw out muscular fatigue. Nancy, you already sort of alluded to that earlier. And in the presentation that you gave, you did mention a couple of great resources that I didn't know about. So thank you for pointing me to the canine fatigue paper. One thing about type 1 muscle fibers, which we think make up between 30 to 50% of the human thyroid muscle. We have very little data on that. Those are not non-fatigable, those are fatigue resistant, and they will fatigue eventually in any muscle. And the canine study was interesting. It certainly gives some support to the idea that the thyroid muscle is quite fatigue resistant, and I think that's definitely true based on its muscle fiber makeup. But I would hesitate to completely say that there's no muscular fatigue or it's not likely, and particularly I like the discussion earlier about individual variability and about training and the effects potentially of detraining, particularly in this time where professional singers currently are not singing as much as they used to be. So there's a whole lot of work that is yet to be done, which I hopefully will contribute to a little bit, along with Mary Sandage, a good colleague, and many others. So just want to throw that out there. And also related to that, I'm wondering if because there's this discussion about nomenclature, and Eric, thank you for your paper and your colleagues getting into that, the nomenclature, maybe vocal fatigue in and of itself is a bad term to use. Maybe we need some new terms that separate these different aspects, or maybe qualifiers, so that instead of talking about, well, someone is vocally fatigued, and then have to qualify, well, what do we mean by that? Is it the neuromuscular? Is it the psychological? Is it the all these different things? So maybe we should start thinking about new terms, or having qualifiers just in terms of when we describe the different types of vocal fatigue. And I'd love to get the panel's thought on that.
I think this term is so embedded and ubiquitous, and people kind of sense what it is, that I'd hate to throw it out. I don't want to throw out the baby with the bathwater. I actually question throwing out the term vocal load, Eric, with the bathwater, because loading is such a common term in mechanical sciences, as you know, that a load is very well defined. And when we talk about a vocal load, we talk about that same sort of adding an extra resistance or an extra something. But in terms of vocal fatigue, I think, that is the point. I don't know what we would throw it out and use instead, Aaron. I do want to thank you though for correcting me on the muscle fatigue. And but so to go back just for a second, my 2008 paper has a much more thorough review, but there's really very little literature on that, as you know, and I look forward to your future papers on this. I still wonder whether the muscles themselves would, I guess when I use the term fatigue, I'm using the terms from Anoka and Stewart and Zia Hassan and all their colleagues at Arizona that talked about, a muscle breaking down to the point of it can't exert the force that it was exerting. I mean, that's the definition of a fatigued muscle. And seems really unlikely. I guess maybe the CT muscle could perhaps do that, and that it would be harder over many, many hours of performing to hit the high notes because of it, but that could also be a non-muscular issue. So in the performing human, I still think that the muscles are going to be the least of the worry compared to the other problems, but acknowledge these muscles, yes, eventually any muscle will fatigue. Yeah. So anyway, any other comments on just abandoning the term vocal fatigue and trying something new?
I wanna add. I think the term vocal fatigue, yes, it is that complex term. But agreeing with you, Erin, is that the qualifiers are nothing but what we discussed is the modulating factors. So I think when we study, you're saying, what are the qualifiers? I think when people study this, if we can add what aspect of vocal fatigue is being targeted, and then that gives us a little bit more clarity instead of this broad umbrella of vocal fatigue. But for example, the paper that I'm working on, or my topic right now, is metabolic issues. So I'm specifically targeting on oxygen consumption, and I'm talking about what is the recovery that happens, whether there is an anaerobic or aerobic means of using a voice. So the vocal fatigue is specific to the bioenergetic pathway or the metabolic mechanism, rather than this, and then correlating it with the perception. That is, when I measure this, is there a change in perception during the task when the person is completing it, and talking specifically about that, than just saying that this is the entire mechanism of vocal fatigue. I mean, just doing this talk I was sharing with Nancy, has broadened the way I had to take a step back and say, yes, we all need to really look at fatigue in a very different perspective instead of using this broad umbrella. I don't think I agree with Nancy. I don't want to throw out the term vocal fatigue, but I think maybe everybody that's contributing to the literature, which is a lot of people that's working on this, to place those qualifiers or modulating factors when discussing about that. So we know this paper or this group is looking at neuromuscular fatigue. This group is looking at psychological contributions, individual factors, and then talking really about that. This group. So then we can kind of say, these are the different modulating factors that have been studied. Is there any commonality that we can understand when we talk about vocal fatigue in general? That's just my 2 cents.
I'll just say I wasn't really suggesting we get rid of the term vocal fatigue. I was just trying to stir the pot a little bit to get some discussion. So.
Quando a Mara fala, eu entendo bem, porque é brasileira falando português, né?
Então, eles deveriam ter pouco de critério e falar mais devagar, né?
Excuse me, are you asking a question? I hear it just says iPhone, so I don't know who this is. Okay. Anybody else raising? Anybody else at the microphone?
I put
I'm
my
at the
raised
microphone.
hand.
Oh,
I'm not
very
sure
good.
it
Yeah,
went.
I saw Mara pop up before. Mara will go, and then we'll move to Ron.
Yes,
Thank you.
I do agree it's not a good term, but on the other hand, when we talk about vocal fatigue, any patient knows if he has or has not. So there is an inner feeling of what is vocal fatigue. The term is not good, but the patient said, yes, yes, I have. Yes, no, 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 I do not get fatigue. So this is one point. And the second one, what would be a good list of tips for us clinicians to give the patients and performers to avoid vocal fatigue, such as reduce loudness, make intervals, speak slower? What would be in that list? Can you come up with some ideas to help the clinicians?
I would actually go to Chaya for that first, and then we can move to Marco, because I think that Chaya's surveys on how to identify fatigue and what to look for in the VFI will give you those answers. Chaya, do you want to follow up? Am I
Yeah,
on the right track?
so I think, it brings that really good concept. I think how fatigue, initially the whole concept of VFI came in to say, how do people define, like, what do they experience when they say I'm experiencing fatigue? So one is just asking that question, do you experience fatigue or not? But then if you start probing into somebody who says I'm not experiencing fatigue, and put in the question, does your voice get weaker? Do you feel like your voice gets like, if we start probing, then they say, oh yes, I do have this. So I think that fatigue term, yes, it encompasses so many things, including effort, and then the recovery from rest. So I think the term is not perfect, but it does capture this broad umbrella of self-perceived sensations, which I think is the biggest thing that we are all saying that we want to keep with us. The measure's objective is important, but knowing that the patient knows what they're experiencing, and we're saying that this may come under the umbrella of vocal fatigue, even though the term, they don't say I have fatigue. So I think keeping in line with the self-perception is important, and then maybe having all of those features under vocal fatigue to fall under that will help us kind of probe more and understand that perceived sensation of fatigue. I hope that answers your question, Mara.
And Marco, would you like to add anything?
Yeah, thank you, Mara, for your question. Thank you, Nancy. Yeah, I would add avoid to talk too loud in noisy environment. That is a very important way to avoid a little bit vocal fatigue. That is to control environmental aspect of the vocal demand, which is the first definition that was defined in the Dr. Hunter paper. So to control some aspect of the environment, that's very important also. And also I would like to highlight a very important point that is usually misunderstood, which is the breath support. This is a huge topic, and it is usually very misunderstood, Nancy, because some patients think that it is a good behavior. I mean, it is good when you contract your abdominal muscles. And I don't think that is really necessary. Actually, sometimes when you contract your abdominal muscle higher than you need, you can increase the sensation of vocal effort and vocal fatigue. So I think the contraction of abdominal muscle, this so-called sometimes breath support, it is a huge topic that sometimes is not really well addressed in this kind of conversations. And it is very risky when people think that in order to avoid neck muscle tension, they need to put more tension in the lower parts of the body. Yeah, I mean, I have found in my findings that when we use, for example, semi-occluded vocal tract exercises, you can activate a little bit more abdominal muscles, but just a little bit, not much higher than you really need to talk. Yeah, I just wanted to say that. I think that's very important to avoid vocal fatigue and vocal effort.
Very helpful. Thank you.
Hey, Nancy, can I just follow up with something? I'm not a clinician, and I don't even play one on TV, but I was just thinking after listening to yesterday's discussion with Mara led of how fatigue is this generic term that some people complain of. And the other one, which came out several times, is people's complaint of lack of, of heightened effort. And that sometimes, as a clinician or even if my sense of voice scientist, we're trying to improve quality, but really the person's goal has nothing to do with quality. They just want to have a reduced effort. And so I look at this as fatigue has all these components, and I used to talk about fatigue all the time. Lately, I've been much more on the effort bandwagon because we've been trying to think out, we think we can, and this is some papers we're writing up right now, I did with Mark Barty, but we think we can tag it and we think we can follow it and it's repeatable. And I'm like going, holy smokes, we do this, it gives the clinicians all these tools, and then it lets us find out when our effort, how much of the effort is because, or how much of the fatigue is because of their sense of effort, and their effort is just bleeding over into fatigue, or too much effort actually causes a change in performance, which is fatigue. And you have these corresponding things. So I've been the panel is talking about fatigue. I think I'm going to put a big sign above my head that just says effort all the time. So that's my new term.
So we have time, thank you. We have time for one more question. And Dr. Ron Scher, it's so good to see you. Could you please speak up and tell us your question?
Yeah, this is, can you hear me okay?
Absolutely.
This is on that terminology a few minutes back. It seems like the current expansion of the research in fatigue creates a readiness for for phlegm, apparently. I'm not sure. Creates a readiness actually for a consensus meeting to create a draft of a classification system for fatigue. You guys really have kind of originated that here in this. So that should be considered, I would say, and maybe Voice Foundation could sponsor that. Two other little things. This word load that you just brought up, I'm so glad you did, because it's really strange to use the word load for a long-term use of the voice, for example, rather than its real meaning for a rather, larger force applied at a particular time to a system. So I never really understood the word load there, but it was kind of cute. And people use it. But the other thing that I'm really confused about, this is a really naive orientation. The word fatigability has been used as a pattern, I guess a measure, a performance measure, but it seems fatigability is actually the ability to be fatigued. And a lot of people are prone to be fatigued. And so it seems to me fatigability should be a literal translation of that word. And we use consequences of fatigue relative to the measures, the signs, reduced range of, vocal variables, objective measures, etc.
Thank you for your clarity on these terms. I have to admit that I've gone along with the vocal fatigue bandwagon for a number of years. I never loved the term vocal loading either, but because it became popular when I was doing my research of 20 years ago or so, I started using it. Eric is proposing the term vocal demands instead and just getting rid of vocal load for that reason. Your point about the consensus meeting, the article, Hunter et al. 2020, is called a consensus definition of vocal fatigue. And so if you haven't seen it yet, it's an excellent read. And he previewed it in his presentation. So just a point on that. And the final thing you mentioned,
And Nancy, I just kind of call up when I worked with the co-authors on that consensus. Vocal demand and vocal demand response, we went round and round, and that actually came from when Susanna presented at PVOC. Chaya, was that right? She presented at PVOC because we were trying to figure out what to do. And so I'm actually okay if people propose new definitions. We need to settle on some. But the conceptualization of the definition of some of the concepts, and this is where loading, and even demand and demand response come in, is there something that is a noun, which is a thing that is an objective, kind of like what effort runs into, is you have this thing that is that is an obstacle or an objective or a goal that is independent of a person. And then there's what that person does, their performance, their response to that demand a response to that objective, which can be loading if you use it in terms of a verb. The idea is there's this noun that exists, and there's this verb that we do, this performance, this demand response. Now, however we capture that, I'm actually okay. I mean, I'm on paper's a paper. The idea of science moving forward, but in this idea, these concepts is we have obstacles, we have demands, we have goals that are not us, depending on our fatigability, our capability, and everything else, our training. Then there's how we perform them, and has repeatability and everything else. And then what's our exertion, which goes in towards the effort or our experience of exertion. And there's this overall concept of I experience fatigue in this, whether I have it all the time or I'm feeling pain. And so getting these concepts down and trying to get them will help us in the clinical population, in the research population, because then we even know what to measure.
Yeah.
What part of this am I measuring? And that has been a real thing. Am I measuring which part? So anyway, I'm talking too much.
Well, actually, we're out of time. If I was at Voice Foundation, I would see that red light blinking at me saying we are out of time, but obviously we've just hit the tip of the iceberg here. There's a lot to discuss. I think that the concept of vocal fatigue, I had no idea that it was going to be this popular, but again, just going to that roundtable yesterday where they spent 15 minutes of their discussion just on vocal fatigue being such an important clinical concept tells us how important this is right now. And I'm glad that we're grappling with it and bringing together the experts. We will continue doing so at future Voice Symposia, and I thank all of you, my esteemed panelists who answered the call and stepped up when we had to go virtual, bringing their expertise to the world, and all of the wonderful messages we're getting from all over the world. You can look at the chat room to see how far. Thank you for coming to the Virtual Voice Symposium special session question and answer panel, and I hope to see you in person next year. Thank you so much.
Thank you, Nancy. Thank you so much for putting together this panel, and thank you, Voice Foundation, for letting us all contribute. This has been great.
Thank you, Nancy. Thank you all. Bye-bye.
Thanks.